Hi, I'm Dr. Christy Del Castillo Heggie. I'm one of the co-founders of the Fed is Best Foundation. And I am here with Heather Curran for World Breastfeeding Week. We are putting out a series of interviews of real moms sharing with you their real life infant feeding experiences. Okay, Heather, thank you for being with us.
Yeah, hi.
Okay, so tell me a little bit about yourself.
So I have two little boys, about 2 years apart, almost exactly the week. And I nursed both of them, and they were two very different experiences. I feel like most new moms who go in planning on nursing expect, everything goes very smoothly, no issues. And for my first son, it mostly did. Like, he latched right away, he nursed constantly, which, I mean, he was hungry, I guess. But I did develop mastitis, which I didn't even know about that, when that can happen. So that was a month in, and that was a struggle to get through those few days. But once we got past that, it was smooth sailing. Everything was going pretty well. Again, I got mastitis about 6 months later, but as soon as I knew the signs, I got treatment for it right away, and it wasn't nearly as bad as the first time. And then we've made it to about 13 months when I finally stopped nursing, and that was
Yeah.
pretty much it for the first time around. For my second son, I said, my first one, he latched right away, he nursed great. There's no reason why there should be any problems the second time around. So again, I had my second son, he latched great, he started nursing fine, and then about 3 months in, he started to really pull off and not want to nurse. It seemed like he would just nurse for a little bit and then pull off screaming. And I was like, what is going on? I felt like I was kind of like forcing my breast in his mouth, and he just wanted no part of it. And we went from nursing every 3 hours for like 20 to 30 minutes to nursing every 4 hours for maybe like 5 minutes, because he just was not interested. And then I would make him bottles, whether it be pumped milk or formula, and he wanted nothing to do with it. So it was a struggle for a few months. I eventually just slowly cut out nursing times and started table food. And he eventually just started eating. For my second son, he was diagnosed with a tongue tie in the hospital. The day after I had him, the pediatrician came into the room and checked him out, and we had that corrected right away. And it still didn't really affect his nursing. Because, like I said, when he was born, he latched right away. And he seemed to be doing everything that my first son was doing with nursing well, but he wasn't staying on as long as, every baby is going to be different. And then it was around, I say like 4 months that he started to pull off, not really interested in nursing. And probably 4.5 months, closer to 5 months, I did start introducing solids. And people are telling me, well, it's because you introduced solids. You can always pull back on that and continue nursing. But I didn't want to do that because he was loving his solids. I wasn't going to take that away from him. And he just was more interested in food. I wanted to have that breastfeeding relationship like I had with my first son. And I also felt a little guilty because I had cut off my first son at 13 months. I was like, this with my second son, I will just continue to nursing him until he feels ready to get off, whether that's 12 months, 18 months. Like, I was prepared to nurse till, he was a little older. And then with everything that happened of him not wanting to nurse, like he would latch for, I don't know, like 3 minutes would be a good nursing session. And to me, that, like, compared to my first son, 3 minutes was nothing. My first son would nurse for um, like 10 to 15 minutes. So it was such a difference.
Did your health professionals have anything to say about why he wasn't taking to the breast well?
No, they just said keep trying. It's probably because he's drinking faster or more efficient at draining the breast than my first one was, which is why they said why my first one nursed for such a long time. But feeling it didn't feel any different. So I wasn't sure if it was that or whatever. Like I said, I had tried bottles, and even bottles, he refused the bottle, whether it was breast milk or formula. But he was very much into table food, so I just continued to try and balance it out with the table food.
Well, the pediatricians are shifting their recommendations and kind of tailoring it to each child if a child needs table food by 4 months, especially with in families with increased risk of allergies. They are recommending that they be introduced solids at 4 months, and especially if they have a dietary need for it. So it sounds like your son really did have a dietary need. Was he growing okay?
So he was born at 9:13 and gained a pound before we even left the hospital.
Wow. Just on breast milk?
Just on breast milk.
Wow. That's wild. Yeah, you're at the very top of the curve then.
Right. And he was still growing at a decent rate. So it wasn't like he was underweight or starving or anything like that.
That's
so
awesome.
they're like, well, he's fine, just keep trying. And of course, like, I kept trying, and we did last a little over 12 months. He turned in June.
Good.
But it got to a point where it was like 6 months into it, and I was like, there's no way I can just continue nursing him anymore. Like, I was tired of it. I wanted to just give up.
Is it because you were having to do it frequently or something because you were worried, or
So
what was it?
If he wasn't nursing, I would then just pump to relieve myself. And it was like, I'm not a fan of pumping just personally, because it was more of like an annoyance to me than anything else. Like,
yes.
So once those couple months passed, I was like, okay, I can just continue this. And sit back, please.
How does it feel?
Hi, cutie. He's cute. Bye.
So it had gotten to a point where I was like, all right, he turns 1, I am done nursing, because it was just such a different real life experience that happened than what I had planned. Like, this fairy tale of allowing him to just nurse when he wanted and everything.
Well, what just moving on to my next question. Okay, so what is one thing you would say to yourself as a first and second time mom? What would you say to yourself as the one piece of advice you give yourself?
The advice I'd give myself would probably be that breastfeeding isn't as easy as they make it out to be, and to be prepared for an infection like mastitis, or your child just not wanting the breast.
Yeah.
I feel like you grow up thinking that it's natural, it's part of your body, it's part of human nature, how we've all grown, and it's not as simple as they like to make you think it is.
Is there anything you would want to say just to the general community, how they should talk to moms, support moms, and I mean, not just at home, but out in the community and as far as in health professionals as well?
I'd like to say, try and think of any question to ask about it before you have that notion in your head that you want to do it. And oh, hold on, he got himself stuck.
It's okay. Okay, that's okay. Good.
He climbed into my younger son's pack and play.
Yes.
Okay. So I like to say, be more open of things that could go wrong rather than just focusing on the benefits and why you should do it, because it's not as black and white as a lot of health professionals like to make you think it is.
And what were the successful things? What were the things that helped you reach your goal? Yeah,
Okay. Yeah. So the first time nursing, both my boys were C-section, so we had to wait. But the first time getting them in my arms and they latched so beautifully was the best feeling ever as a new mom.
That's great.
And I just loved all those bedtime cuddles for that first year. Like, I know my mama, that's her smell, and I want to cuddle with her, and having them cuddle up on you it's great. Like, I love that, and I'm very thankful that I made it to just about 13 months with both my boys.
Great.